Hello and welcome to this episode of our Health Nuggets. My name is Aida Munzati, and on today's show we are going to look at epilepsy being International Epilepsy Day. That's why I'm in purple, just to be in solidarity with people living with epilepsy. So we're going to look at different aspects of our epilepsy, from the diagnosis, the causes, the treatment, just to make epilepsy a health priority.
You could say in Kenya about 2% of the Kenyans could be living with epilepsy, and that is what we are translating to be 1 million. Treatment gap is those people with epilepsy that are not receiving appropriate treatment. So it's about 80%. So meaning that only 20% are not receiving appropriate treatment, either because they don't believe that the treatments can be able to assist them control the seizures, or because they have other barriers that are making them not access treatment.
Well, so those are epilepsy statistics, not just in Kenya, but worldwide as well. And now to confirm these statistics and just to delve further into this conversation, even as we mark International Epilepsy Day, I'm being joined by the chairman of the National Epilepsy Coordination Committee, that is Dr. Simon Kariuki, as well as Sam Kivinda, who is a person living with epilepsy, just to share his experience as well as better awareness on this day. Karibuni sana to the set, gentlemen.
Yes, thank you.
So thank you so much for your time and even for the opportunity just for us to create awareness and more awareness about epilepsy. And starting with you, Dr. how does the numbers look like of epilepsy in Kenya and also worldwide?
Yeah, so epilepsy is not only a serious condition, but it's also a very common condition, and that is worldwide. We know that around 70 million people live with epilepsy, and here in Kenya we estimate that around 1 million people live with epilepsy, and that is based on the prevalence studies that have been done here, which shows that 20 in every 1,000 people may be having epilepsy. So if you apply that to the population in Kenya of around 50 million people, then that is going to be at least 1 million. But I think that is when you count the numbers, but there is also these new cases which occur every year, because it is those new cases which accumulate over time, and then they give you the total number of cases of people with epilepsy, and that is what we call incidence, and in Kenya it's around 70 per 100,000 people. But the numbers that we have so far really do not represent the true picture, and we think that the numbers could even be greater, because previously we've been focusing on convulsive epilepsies, that is epilepsies which have some physical manifestations, but there are other forms of epilepsy which can present in ways that you cannot be able to see, e.g., perturbations in concentration, some behavioral manifestations, sometimes even a blinking of the eye, especially in the case of the absences. So if we were to do studies that were going to include those types of epilepsies, I believe the numbers would even be greater.
How about worldwide?
So in the world, the numbers are around 70 million people. But I think if you compare high-income countries and low-income countries where we are in Kenya, we think that our numbers are 3 times more. So when I'm talking about 20 per 1,000 population in Kenya, if you go to a high-income country, so like Great Britain, for example, you'll find that the prevalence is allowed 4.5, all 5 per 1,000 people. So you can see then in that case that our prevalence is 3 or 4 times greater, and that is related to so many reasons, including some risk factors that usually increase the risk for epilepsy.
Okay, before us looking at what exactly epilepsy is, because you might be assuming that people know what epilepsy is, let's just talk to Sam, who you're a person with a lived experience of epilepsy. When were you diagnosed and how has the journey been to where you are today?
It's been 30 years, so 1992 if I'm not wrong.
So you were diagnosed when you were how old?
I was just about to do my standard 8. So how old is someone on the
Around 13, 14 years.
Yeah, around there. Yeah.
And how has it been, maybe comparing then and now, how is it? Has the stigma reduced? Did you face stigma or?
Given the period of time that I've lived with it, I'd tell you I've been a very lucky person because of what I have seen and encountered. In comparison, I won't tell you that I've really been stigmatized over the years. My parents took me to see a doctor. I was diagnosed. MRIs were done, the full tests, and I was given drugs. And initially, I wasn't used to it, so you skip